Hey there again, it's your friendly urologist, Dr. Charles Modlin, here with you again, the listening audience, for another health equity brief. Again, these health equity briefs are opportunities for me to impart upon you, the listening audience, important information I think is that you, your family, community need to know to maintain and improve your health and to stay healthy. Today's topic, I'm going to talk about obstructive sleep apnea, abbreviated as OSA, obstructive sleep apnea. So actually, what is obstructive sleep apnea? It's a serious sleep disorder characterized by repeated airway blockages during sleep. African Americans have a higher prevalence, greater severity, and worse outcomes compared to white individuals, both in adults and children. So obstructive sleep apnea is another example of a health disparity that disproportionately afflicts and burdens African American populations. So the pathogenesis, what causes obstructive sleep apnea? Repeated collapse of the upper airway during sleep leads to oxygen deprivation. The brain signals the body to open or reopen the airway, and this disrupts the individual's sleep. Chronic oxygen deprivation, as we know, increases blood pressure, causes hypertension, stress hormones to be released, and diffuse inflammation throughout the body, leading to long-term health complications. The complications of untreated obstructive sleep apnea include, but are not limited to, cardiovascular disease, increased risk of hypertension, I mentioned, heart attacks, strokes, and arrhythmia. That's abnormal heart beats. Type 2 diabetes can be precipitated and worsen as a result of obstructive sleep apnea. Insulin resistance worsens with untreated obstructive sleep apnea. Individuals can get cognitive decline, memory loss, concentration issues, and there's an increased risk for developing dementia and worsening dementia. Obstructive sleep apnea causes daytime sleepiness that can result in higher risk of accidents, poor work performance, and depression. And worsen mental health, increased rates of anxiety, depression, and mood disorders. So I indicated that this is a health inequity, health disparity, especially in black populations. African Americans have a higher prevalence of OSA than whites, with studies showing that African Americans have up to 2 to 3 times greater risk of developing obstructive sleep apnea. African Americans are also more likely to experience more severe OSA and are diagnosed at later stages, thus increasing complications. Mortality rates are higher in African Americans due to increased risk for cardiovascular disease, stroke, and uncontrolled hypertension, high blood pressure linked to their untreated obstructive sleep apnea. Again, causes and risk factors, anatomical differences. In general, African Americans have been found to have a shorter, wider airway and increased upper airway collapsibility, leading to higher risk of obstructive sleep apnea. Obesity contributes to higher rates of obstructive sleep apnea and higher prevalence rates. Genetics actually can play a role. Family history plays a role. African Americans may inherit airway structures that predispose them to obstructive sleep apnea. It just underscores the importance that we as families should communicate with one another what our family medical histories are. Socioeconomics and healthcare barriers contribute. African Americans have less access to sleep studies, sleep labs, and CPAP, that's continuous positive airway pressure treatment, leading to underdiagnosis and undertreatment and delayed diagnosis. Again, delayed diagnosis, many African Americans are diagnosed years later than whites, allowing the condition to worsen. So what are some of the signs and symptoms of obstructive sleep apnea? Loud snoring, episodes of breathing pauses often observed by a partner, excessive daytime sleepiness, morning headaches, difficulty concentrating, and memory problems, irritability and mood disturbances. And in children, often is what is observed as poor academic performance, hyperactivity, and behavioral issues. Again, why are there disparities? I mentioned relative deficiencies or lack of access to health care in many black populations. Also, black populations are less likely to receive, again, sleep evaluations and CPAP prescriptions. Medical mistrust, we've talked about that before in the health equity briefs. Lower rates of medical follow-up and adherence to treatment in many black and brown populations based on some of the things we've spoken before that lead to distrust of the healthcare system. Obesity and other comorbidities, higher rates of obesity, hypertension, diabetes contribute to the severity of the obstructive sleep apnea. And again, slower or other socioeconomic factors, social determinants of health, poorer sleep environment, stress, shift work schedules, all contribute. So how do we diagnose obstructive sleep apnea? Basically through sleep studies. The gold standard is a sleep study conducted in a sleep lab to measure the apnea. Apnea means the period where the individual is not taking breath and is oxygen deprived. We can put a pulse oximeter on individuals that measures the percent saturation of oxygen in the blood. And then during that sleep study, the brain activity is also monitored. Some of these sleep studies can be conducted by using home sleep studies, home sleep apnea testing, abbreviated HSAT. It's a portable at-home test used for moderate to severe sleep apnea evaluations. So can sleep apnea be cured? It can be controlled but not always cured. Weight loss and surgery can resolve OSA in some patients. Lifestyle modification, sleep apnea therapy effectively manage symptoms long term. Again, we're talking about the treatment options. CPAP, again, continuous positive airway pressure. It can be one of the most effective treatments. It keeps the airway open during sleep. Not everybody is able to tolerate that long-term. Oral appliance therapy, sometimes the dentist or the oral surgeons can custom-made and custom-fit mouth guards that reposition the jaw during sleep to prevent airway collapse. Again, weight loss can mitigate some of the signs and symptoms and severity of obstructive sleep apnea. Surgery, oral surgeons can actually perform surgery to remove some of the excessive throat tissue. Postural therapy, including encouraging side sleeping, can reduce airway obstruction. And then there's a newer surgical therapy called Inspire. It's INSPIRE, Inspire therapy. It's a surgically implanted device that stimulates the hypoglossal nerve. That's the nerve up in the neck that controls the movement of the tongue to prevent airway collapse during sleep. When you're sleeping, the tongue actually can fall back and obstruct the airway passage. So Inspire therapy is an implantable device. Like I said, it delivers a mild electrical stimulation to the tongue muscle, preventing airway collapse. It's an alternative for patients who cannot tolerate CPAP therapy. It's controlled by a remote device, turning on stimulation before sleep. I talked about the causes, the pathogenesis, but just to summarize, there can be significant complications from untreated obstructive sleep apnea, cardiovascular disease, type 2 diabetes, cognitive decline, daytime sleepiness, somnolence, worsened mental health. And the conclusion, African Americans have higher rates of obstructive sleep apnea, more severe symptoms, worse health outcomes than whites due to a mix of biological, genetic, socioeconomic, and access to healthcare factors. Early diagnosis and treatment was CPAP, Inspire, surgical therapy, weight loss, and lifestyle modification changes can significantly improve symptoms and reduce complications. Addressing disparities in sleep medicine access is critical to improving health outcomes in African American communities and other communities. So obstructive sleep apnea is not an everyday topic that you hear about, but it's very important. It affects not only adults, but also children, higher incidence and mortality, morbidity rates in African American populations. Spread the word, ask your family about whether or not there's a family history of obstructive sleep apnea, observe your children, and consider this as a potential cause of some behavioral issues, poor performance in school that your children may be experiencing. See your pediatrician, go see your primary care providers. All right, thank you. Keep connected with me for more health equity briefs. Please like, share, and spread the word about obstructive sleep apnea. Go back and watch some of my previous presentations and health equity briefs. Until next time, I'm Dr. Charles Modlin. Thank you.